Everyone. We are Team 8 More Weeks, and we are going to be presenting on burnout in nurses during the COVID pandemic. So, what is burnout and how do we measure it? So, burnout is referred to as a state of physical, emotional, mental fatigue that is due to prolonged stress that has not been managed effectively. So, some physical symptoms that we might see in someone that has burnout would be frequent illnesses, headaches, and other physical complaints like GI issues, lack of motivation, or substance abuse. So, one common way to measure burnout in someone is using the Maslach Burnout Inventory, also known as the NBI. There are other questionnaires and other ways to do so, but Maslach, the NBI, was what we saw very commonly in our research studies. So, there are three components. First being emotional exhaustion, the second is depersonalization or feeling detached from your work or not connected to your patients, and the last component is personal accomplishment or lack thereof. So, with someone who has burnout, we would see very high scores on the first two components and a very low score on the last component, which is the personal accomplishment. So studies showed pre-COVID nurses did struggle with burnout. About 35% of nurses experienced at least one symptom of burnout, with burnout doubling the odds of poor work performance. We also show that 31.5% of nurses that left their jobs reported burnout as a reason that contributed to that decision, and highest rates of burnout were seen in nurses that worked in pediatric, oncology, and emergency departments. So we can see that pre-COVID, burnout was a pretty big issue. And when we mix COVID into all of this, we do see an increase in burnout rates for nurses. So surveys show that over 50% of nurses felt overwhelmed, 60% had difficulty sleeping. A general survey of all healthcare workers showed that 93% of those surveyed experienced stress and 76% reported exhaustion and burnout.
Let's look at the risk factors and research findings regarding nursing burnout during the COVID-19 pandemic. The main component of nursing burnout is stress. Nursing burnout during COVID-19 varied depending on risk factors. Risk factors include a lack of healthcare resources like PPE. Inadequate supplies of PPE increased burnout rates, contributing to increased fears of contracting COVID-19 or transmitting COVID-19 to patients, healthcare workers, or family members. In Spain, the average nurse-to-patient ratio increased from 8.8 to 13, and the average nursing shift increased from 8 to 12 hours. A lack of adequate testing contributed to fears of not knowing if someone contracted COVID-19, was asymptomatic, and possibly transmitting the virus to others. The unknown understandings of how to treat those infected with COVID-19 also increased healthcare workers' stress. Having to self-isolate when exposed and having to self-isolate at home during the lockdown prevented healthcare workers from living their everyday lives and partaking in healthy coping mechanisms such as exercising or going out in public. Fears of dying and coping with the deaths of patients, family members, and co-workers contributed to burnout. Most studies found that being a frontline healthcare worker increased the rates of nursing burnout. However, other studies suggest some frontline nurses reported a decreased sense of burnout. Let's discuss our research findings. Frontline nurses who reported an increased amount of stress and feelings of burnout were unfamiliar with caring for patients in critical care settings. For example, perioperative nurses who worked in outpatient surgery were redeployed to care for COVID-19 patients. Some operating rooms were transformed to intensive care units. Non-critical care nurses had to be retrained on how to care for patients on ventilators and how to triage patients. This level of unfamiliarity increased the stress of redeployed nurses. However, some nurses reported lower rates of burnout. Nurses who were experienced with critical care settings felt a sense of purpose and duty to care for those affected by COVID-19. They felt an increased sense of control, felt supported, and utilized their experiences working in trauma settings. Resources were redistributed to care for COVID-19 patients, which also helped support frontline nurses. Generally, research suggests that nursing burnout rates increased significantly compared to rates before the pandemic. The contributing factors of nursing burnout increased anxiety, depression, insomnia, and distress. Overall, nursing burnout depended on the nurse's risk factors. Increased workload, a lack of social support, and a lack of resources in the workplace and personal lives are some of the main contributing factors to increased burnout rates.
Now let's look at solutions. What can the hospital do to help prevent the burnout of nurses? First, support your nurses. And this can be done in multiple ways, like decreasing workload, scheduling adequate time off for rest, and providing extra time off to care for loved ones should they fall ill, providing enough PPE and supplies, and providing priority access to testing and vaccinations. Next, consider that burnout can stem from stressing over the lack of experience in dealing with something that's so new and unknown, like COVID-19. Extra training regarding equipment, like ventilators, or keeping staff up to date regarding the virus itself and available treatments can aid in building confidence in providing care for patients with COVID. And hospitals can work towards magnet status. There are specific requirements in achieving magnet status where the end results include improved nurse autonomy, better staffing, and more supportive management. These outcomes have been shown to help prevent burnout, so following the framework towards achieving magnet status can be something the hospital can consider implementing. So, what can nurses personally do to avoid burnout? One solution is to seek therapy. Along with burnout, it's common to experience other psychological problems like depression, anxiety, and PTSD. So, seeking professional help through therapy can assist in processing these complicated feelings and finding coping strategies. Maintain social connections. In a time where everyone needs to be isolated and 6 feet apart, it's important to maintain social connections. Decreased support and loneliness can be a major contributing factor to burnout. So it's important to maintain these connections through social media, phone calls, snail mail, what have you, all to remind the nurse that they're not alone. And probably the most important thing on this list is to do things that are good for you, self care. For example, sleep, eat something tasty, exercise, laugh. Basically, take time to do enjoyable things to take away stress and create balance. And finally, here's a slide provided by Ohio State University on methods that anybody can implement to cope with COVID. So that's control the things that you can, not the things that you can't. Open up and share feelings. Practice daily stress reduction tactics. Engage in mindfulness. Count blessings. Overturn negative thoughts to positive. Volunteer to help others. Identify helpful resources and supports. And last, do your part to prevent the spread of the virus.